About 1 in 10 babies are born preterm every year. According to the CDC, that's about 400,000 infants born before the normal 37 to 40 weeks of pregnancy, which means they miss important growth and development in those final weeks. And preterm birth is the leading cause of infant mortality. This month is Prematurity Awareness Month, and joining me now is Dr. Beth Carewe, an OB/GYN from Rose Medical Center. Thanks so much for talking with us today.
Yeah, thanks so much for having me.
Okay, so babies who do survive, they can have short and long-term health problems. Why are some babies born early?
You know, there are a lot of reasons, and some of them we understand and some of them we don't understand. Sometimes there's things like infections that can cause babies to be born early. Other times there are other medical conditions that moms have, such as preeclampsia, which is a blood pressure condition of pregnancy that leads to early delivery. And sometimes moms just go into labor and we don't always fully understand why, that happens for them.
Are there any signs and symptoms to look out for?
Yeah. So that's probably the most important thing, is just awareness of the signs and symptoms. And it can be tricky because a lot of them are pretty nonspecific. So things like cramping, bleeding, an increase in discharge. And, sometimes these can be normal during pregnancy, but other times, they might be a sign of something more concerning going on. So we always just tell our patients, if any of these things happen, call us, and, we can kind of decide if this sounds like something that's more concerning or if it's something that's just more normal.
Is this something that can be prevented?
Absolutely. Yeah. And so, there's a lot of risk factors that we know about for preterm delivery, especially history of having another baby prematurely. There's other medical complications that can increase risk for premature delivery. So it's really important that you let your doctors know about that, so then they can employ some prevention. And sometimes it's just monitoring. Sometimes it involves medication. Sometimes, there's even some surgical procedures we can do to try and help moms, avoid a premature delivery.
When we're talking about awareness, we've learned about poverty, lack of access to health care, discrimination. Do those all play a role in this?
They do. And this is one of the many things, especially in, around pregnancy and childbirth, where there are disparities between, women, our Black non-Hispanic patients, as well as, around age, younger moms, poverty, malnutrition. All of these things can impact rates of preterm delivery. So very important that, your provider addresses these issues.
Very important information to know. Dr. Carewe, thank you so much for talking with us.
Of course. Thank you so much. Have a great day.
Okay, you too. And remember, you can watch all of our health interviews on cbscolorado.com.